Yes, I'm John Gakwanda from the Kigali Diocese, and it is a great pleasure to really meet you and understand the burden you have in expounding the kingdom of God through the medical work. And it falls very well because here we are preparing to have a conference on East African level for people to be aware of their responsibilities in the hospitals. Because in Healthcare Christian Fellowship International, we believe that more people pass through the hospitals of the world than through its churches. And actually, there are places where there are no churches, but there is no place in the world where you will not find a hospital. So we will be
Somebody from home?
just reminded that wherever we go, as a medical doctor is or a health professional of any category is asked to serve, he can be a missionary in that place. And by the way, the missionary work in Rwanda was started by medical people. And this is a privilege for us also to have this conference organized in here. And it's also a miracle that we are with our brother here, Keith Michael. Dr. Keith Michael is the international coordinator of this work. And he's based in South Africa. And I'm so glad to have this opportunity to share about these things while he's here. So he's here also, he can tell you.
Wonderful. Can you tell us a bit more
Yes.
about how the Anglican Church was started with Dr. Joe Church and the East Africa
Yes.
Revival feature?
Yes, I know that even before I was born in my home place, it's Dr. Stanley Smith who founded the hospital, to which I had the privilege to work in when I grew up. Unfortunately, he was no longer there, but I could just benefit from his legacy that is continuing today. And so many people came to know the Lord at the hospital.
What kind of work did you do?
Yes.
What kind of work did you do?
Yeah, I was just working there as a medical assistant and responsible for the outpatient clinic in that place. And so I had also a privilege to meet when I traveled to England to meet the late Joe Church, who also was very, very active in the East African Revival. And he was also a medical doctor. Thank you.
Wonderful. And what do you do currently in the area of medicine and hospitals?
What's your work that you do now?
Pardon?
What work do you do now?
I'm doing now.
Yeah. What do you
Yes,
doing now?
today, you know that this country has known a terrible tragedy in 1994, the genocide against Tutsi people. And while I was serving as responsible for medical clinic here in Kigali, after the genocide, I had a call to help or to comfort widows and orphans of the genocide. And it's through this ministry towards orphans and widows that I realized that many of them also suffered not only out of the trauma they received because of the genocide, but also many women have been raped. Mm-hmm. And through rape, they contracted HIV/AIDS. Mm-hmm. And these people were always afraid of everybody and of themselves. They didn't want to go to the normal clinics or hospitals. Yes, because they were afraid to be known as having passed or having had this kind of experience, and also perhaps to meet the people who raped them. And then they came here, and I remember even one suggested we need a meeting of ourselves because we started to bring these people together. And she said, no, we would like special meetings for people who have suffered rape, sexual violence. Then we started, and we encouraged them to go for a test. And sadly, many of them were positive. So we started a small clinic here. And then out of this clinic, we tried to expand the activity. And now it is evolving in a small hospital. And here they feel the love of Jesus. And no, it's the approach is holistic, if I can explain like that. Not only for HIV/AIDS people, but also for other people. Because we have a population under our care, which is approaching 50,000. Yes, and it's not far from here. So when this ministry started with the core based on Isaiah chapter 40, verse 1, comfort, comfort my people, it expanded into these other activities, including care for abandoned children, orphans, and also bringing people into communities, depending on the area where they live, so they come together because many have no family anymore, I mean biological family, so they create a kind of alternative family. So they come together and help one another. And for the children, we support them for education. Because we do not want people to always depend on what they receive, that we encourage them to do some activities by themselves in order to develop a kind of sustainable life. Yeah, this is what we are doing today. So what do you see here is it's not just a hotel. It's just a means by which maybe some proceeds can help us to continue our
Yes,
work.
because the hotel is Solace comfort.
Yes, yeah.
Yes.
Yes.
So, would you be willing to tell us a bit, as you're the international coordinator?
Sure, Ed. Yeah, so Healthcare Christian Fellowship was birthed in South Africa in 1936, and with the vision of reaching healthcare personnel so that they could reach their patients with the gospel. And this vision has now spread into, we have branches now in close to 100 countries. And like Jean said, more people pass through the hospitals of the world than through its churches, and that's the kind of slogan that we keep reminding ourselves about. And so hospitals and health facilities are a real mission field. And one of the big advantages of this mission field is that it's usually on your doorstep. You don't have to travel far to find a hospital or a clinic, or to find healthcare personnel that want to approach their patients more holistically. Because even scientific evidence now coming out the last 10, 15 years is showing that if you treat people holistically, their chances of recovery are much better. And so we know that we have to treat the spirit as well as the body and the soul. And so our organization tries to help medical personnel to try to equip them to address the spiritual needs of their patients. And we do that in collaboration with the churches. So we love to work closely with churches and similar organizations that have similar vision. And I must say the last 10, 12 years, some wonderful tools have come out. that help medical personnel to introduce the spiritual component into their daily lives. And so what we're doing right now around the world is trying to equip what we call the frontline worker, the doctor, the nurse, even the cleaner, even the person who serves the food, to be able to share the gospel to that person under their care. So it's a wonderful and exciting time that we find ourselves in. And so pleased to meet up with you folk.
Good to meet you. Now, can you also give us your name and your current active profession?
Okay, so my name is Keith. I'm Keith Michael. I'm a family physician, and I work part-time in a private medical practice in South Africa. But most of my time these days is now spent as the international coordinator for Healthcare Christian Fellowship. And it's a great privilege for me to be here in Rwanda right now, to be part of the East African Regional Conference that we are having here, starting this evening. And we hope to have these regional conferences more frequently around the world, where we can encourage our colleagues and support them with some of these new tools that have become available to equip the frontline worker to fulfill the vision that God has given us, that of making disciples in the health field.